How to spot the symptoms of thyroid cancer, the fastest growing cancer in the US. As women, we know getting screened for cancer is important. Every year, thyroid cancer is an abnormal growth of thyroid cells that has the potential to spread to other parts of the body, says an endocrine surgeon and assistant professor of surgery at UCLA Health. Thyroid cancer, and the condition, is especially common in women, who are 3 times more likely to develop thyroid cancer than men. While the disease, experts don't know why, exactly, thyroid cancer strikes more women, but there are theories. Before puberty, we do know, however, that thyroid cancer is the most rapidly increasing cancer within the US, having tripled in the past 3 decades, according to the. But don't let that. So although the incidence of thyroid cancer has definitely gone up, experts are trying to determine whether that increase is due to overdiagnosis or due to a true increase in the disease itself. This is important. Differentiated thyroid cancer, which is further broken down into subtypes of papillary, follicular, or Hürthle cell carcinoma, accounts for well over 90% of thyroid cancers. It develops in the medullary thyroid cancer doesn't originate in the usual thyroid cells but, rather, in what are called C cells. These cells produce. Anaplastic thyroid cancer is the rarest and most aggressive form of thyroid cancer. It develops when. Here's the really tricky part. Most people with thyroid cancer are completely asymptomatic, says Dr. Tuttle, which is why a good portion of thyroid cancers are detected during other screenings. For the more aggressive, one of the ways aggressive thyroid cancers can become symptomatic is by the local invasion of surrounding structures, including the nerve that controls your vocal cord, says Dr. Tufano. If that nerve is in. Similarly, because the thyroid is intimately associated with the trachea and esophagus, in very rare cases it can cause you to cough up blood, says Dr. Tufano. Advanced thyroid cancer can make swallowing or breathing difficult if the tumor is exerting pressure on the structures within the neck, says Dr. Zanico, including the windpipe or food pipe. This symptom is specific to medullary thyroid cancer because of the proteins this specific type of cancer makes. Sometimes, this symptom is what some physicians will notice incidentally during a physical exam by feeling a lump in your thyroid gland, which is typically painless, says Dr. Tuttle. If you've received as the thyroid cancer tumor gets bigger, it can also cause swelling of the lymph nodes on the side of the neck, says Dr. Sherman. Because there's such a wide range of thyroid cancers with varying degrees of aggression, how the cancer is treated is also pretty individualized. For differentiated and medullary thyroid cancers, the primary treatment is surgical removal of half or all of the thyroid gland and, if needed, the lymph nodes in the region, says Dr. Sherman. Then, the next step for patients who have undergone surgical removal of their thyroid is to receive thyroid hormone medication to make up for what their body used to produce, says Dr. Sherman. In fact, for some patients with differentiated thyroid cancer that's very small and limited to the thyroid, they might not have to undergo any treatment at all. Rather, treating anaplastic thyroid cancer, however, looks a little different because of its aggression. Although they're used to, the most important thing is seeing a doctor who specializes in the treatment of thyroid cancer should you get diagnosed, especially for less aggressive types. You don't need to jump, you have to put the brakes on, says Dr. Tufano. You have to make sure. Gallery 19 signs your thyroid isn't working right, provided by health.com.
Raindrop, drip, drop top, top smoking, no cooking the hot pot. Fucking on your bitch, yeah, that.